The dental implants are something that's generally, from historically, would have been quite a rare thing to get, and patients wouldn't really have asked for it. Now it's become a lot more popular. It's a relatively easy way to replace a missing tooth, where previously it would have had to have been a denture, so something that was removable, taken it out of the mouth, or a bridge to restore a tooth. Dental implants are a lot easier because they're fixed restoration. So if you have a space, you're not having to remove something and replace it and take it out every night. So you can, from one tooth to many teeth, replace multiple spaces or a single unit space. It's really a titanium screw, to keep it nice and simple, is placed into the bone, which integrates around the bone. And after a period of healing, then that is really restored with a fake tooth or a crown to make it look natural and functional. Dental implants, you need to be assessed really for your suitability, but generally speaking, it's suitable for most patients. We offer free examinations for that, and afterwards you're looking around about $2,500 on average to replace that space, which varies of course for patient to patient. Timescale from placement, from initial placement or consultation to generate the restoration of the implant, you're looking at around about 6 months. And it's a surgical procedure which takes a bit of time for obviously things to heal and to integrate before you proceed to finishing the final restoration. Patient need to visit the vet be multiple times, generally about, it all depends really, but you'll be looking at from consultation about 4 to 5 times per implant, and on average implants tend to last a good sort of 20 plus years really. So phase 1 really is consultation to make sure that there's enough bone and the bone's suitable, and the patient understands what lies ahead. The second stage really will be where it's a surgical procedure where you place the implant's placed into the bone and then left for a period of time to make sure that it actually integrates or takes and joins around the bone. Afterwards, if that's the case, then you move on to the next stage, which is really the restoration. In other words, putting the tooth onto the implanted titanium. Alternative, you could get bone grafts, so you can get bone grafts, which is possible and very often necessary really for patients. It sounds, it's pretty simple. You can use sort of synthetic bone grafts nowadays, and that often builds up the bone. So it all depends from patient to patient. Yeah, so Navan Dental really, we do all types of restorations. We're a general dental practice. We treat kids right up through to adults, kids with development dentitions up to adults with little or no dentition. We do everything really from root canal treatments, crowns, veneers, simple fillings, general checkups and cleans. So the restorations and maintenance really is very important to maintain. Once we get patients up to a nice healthy level, it's maintaining it and looking after it. Well, they do, and it is very important. Historically there's an attitude of coming in and saying, right, my teeth are in a bad situation, sort them out and I'll see you again in 10 years, and that's not really what we try and promote. We want to promote good, consistent oral health really, where simple maintenance and regular maintenance really in the long run pays off. If you're looking after your teeth regularly, you're keeping them clean and you're getting them checked, of course, like anything, if anything happens and we get it early, it's much easier and more cost effective to treat. I leave it for 10 years where it's catastrophic. Challenges, I suppose. Patients often come in pain and they want relief of pain. I suppose, is that a challenge? Yes. And often it's probably one of the most rewarding aspects is seeing somebody coming in who's very nervous, maybe he's not been treated well in the past, and looking after them, getting them out of pain, getting them comfortable, and then getting the confidence to a stage where you can rebuild and give them a good positive attitude towards dentistry and their oral health.